Dr. Yendamuri, it's wonderful to have you join us today. We know that you're a very busy person, and we appreciate your time.
Oh, the privilege is mine.
Could you start out by telling us a little bit about yourself and what brought you into this work and to work in this field of cancer?
I was born and brought up in India, and that's where I went to med school. And right out of med school, I came over to the United States to pursue surgical training. And a lot of the surgeons that I ended up training with in general surgery, at least the ones who inspired me, were all lung surgeons. So I naturally gravitated towards lung surgery. During my general surgery training, I actually spent 2 years in the lab where I worked a fair bit on lung cancer genetics. So both the disease process itself fascinated me, and the impact that this disease has on patients motivated me. I think it's a combination of both of those things. And that got cemented when I went to MD Anderson to train, specifically in thoracic oncology.
And is lung cancer hereditary?
There is possibly a genetic susceptibility, with lung cancer, but it's not hereditary in the sense of the term that, if parents have lung cancer, the kids will also develop lung cancer. No, because it's very related to environmental exposure, like smoking.
So screening is important for lung cancer for sure. What are your hopes for the future in the treatments of lung cancer?
We've seen several advances, even during my time, during my career here. I've been doing this now for about 15 years, and even during this time we've seen great strides. We've seen minimally invasive surgery really come into its fore. We've seen targeted agents for chemotherapy. We've seen sophisticated radiation, and over the last couple of years we've really seen an explosion of immunotherapy. I think the biggest advance we are going to see over the next 5 years is more immunotherapeutic agents, more targeted therapy agents, and our ability to treat much smaller tumors, hopefully even without surgery, endobronchially through ablation, and so on and so forth. So we are really seeing an explosion in terms of the technology available to treat patients with lung cancer, no matter what their stage is.
Roswell Park is a research hospital. What type of research specifically is looking at lung cancer and how to save lives?
So we do research, for example, on screening, how to effectively screen, how to catch it early, on developing biomarkers for early diagnosis. Then we do research on treatment of early stage and diagnosis. For example, we've just started a robotic bronchoscopy program, which is much more accurate at diagnosing lesions earlier in their evolution. So we are doing research in early diagnosis as well, not just screening, our ability to biopsy these through new technology. We are also doing research in terms of surgery, how to get patients in and out quicker with less impact on their lives. Minimally invasively, doing smaller surgery to get the same result, and so on. Our radiation therapy folks are working with, being able to develop new modalities of radiation for patients who cannot tolerate surgery and have substantial tumors, and they're finding good results. And of course, I think in terms of immunotherapy, we have several clinical trials that are open and are opening, continuing to open. For example, we have the CMOVAX vaccine that is undergoing clinical trials here at Roswell. And so that is one form of immunotherapy. So we are conducting multiple lines of research on immunotherapeutic agents, or in honing them down to fitting the right therapy for the right patient. So we're doing research on practically every aspect of lung cancer that you can think of.
And how important is community support? Donations that come in for events like the 11-day power play, general donations, and the Ride for Roswell. How important are those funds to your research?
That is critical. And the reason it's critical is like this, is, we do apply for and are very successful in getting funding from the National Cancer Institute, for example, and from foundations. But that funding is available only after a project reaches a certain level of maturity, right? So uh, but for a project to reach that level of maturity, when it's in its early stages, seed funding is very, very important. And that seed funding is almost exclusively through community support, through philanthropy. And just like the name suggests, a seed is critical, right, before you can have a tree. Once you're a sapling, the NCI can maybe support it. But before that, at the early stage, it is community support and it is philanthropy that really, gets us from the seed to the sapling stage.
So every dollar is important.
Absolutely.
And,
Absolutely.
and seed money means that, a dollar is really means more than a dollar, correct?
Oh, absolutely. Because, at that stage, it's like, at that stage, the effect, the positive effect of that dollar multiplies many times over the lifetime of that project. So it's the impact, the positive impact that people can have at that stage of funding for a research project is huge. It's huge, much more than the dollar amount simply would signify.
So we have a lot of people that are involved in our event, our organization called the 11-Day Power Play. We have volunteers, we have players, we have people every day that help us put this event on. They train, they fundraise. Do you have a message for them?
The message I would give to them is what they're doing is very significant. And I hope they understand and appreciate the worth of what they're doing. Because this is going to impact the lives of their family. It is going to positively impact the lives of the people around them. It is going to bring to this community therapies that wouldn't have otherwise existed. So I think it's very important that they realize that what they're doing is so vitally important.
So I just wanted to mention congratulations to you and your coworkers at Roswell Park. You were just recently ranked number 14th in cancer care hospitals across the United States. How does that feel?
It's a validation of our continued activity and our efforts at making this the best hospital that we can make it. And this is 2 times in a row. So the last year, number 14, and this year continuing at number 14. And it's also a validation of the senior leadership of the organization in terms of the direction they're taking us and leading us effectively, especially in trying times like these.
Well, Dr. Yendamuri, I just want to thank you for all that you do. Just recently, in recent years, my husband, lost his mother to lung cancer, and we personally know how important your work is. And we just want to thank you for joining us today.
I'm sorry to hear that, and thank you for inviting me for this, and thank you for allowing me to participate in this event.
Thank you so much. Have a great day.